Welcome, everyone. We're going to get started in a few minutes. Hello, everyone. Thank you for joining. We're going to get started in 1 minute. Hello, everyone, and welcome to our webinar, Connecting Over Food, Breakfast After the Bell, and Other Tools for Helping to Reduce Chronic Absenteeism. My name is Dr. Janine Rios, and I'm going to be moderating the webinar today. Next slide. And it's just some housekeeping to go over. The webinar is being recorded, and you will receive a recording of this after the webinar, of the recording and the slides. And you will also get a follow-up email. It will be from the Center for Best Practices, and it will give you all this information. And also, one thing that's not mentioned here, right after the webinar, you will receive a link to a survey, and we would really appreciate if you fill out that survey and give us some honest feedback about the webinar. And then if you have any questions during the webinar, please put them in the Q&A box. We'll also be monitoring the chat, but please put them in the Q&A box. And next slide. So what are we going to cover today? I'm going to cover a brief overview on No Kid Hungry and a little bit about breakfast after the bell, and a little bit just touching on how breakfast after the bell can help to improve chronic absenteeism. I'm going to introduce our panelists, and we're going to hear a little bit about them, about the work that they are going to share with us today. And then you'll have time for question and answer. And then we're also going to send you off with some resources. Next slide. So who are we? In case you're new to No Kid Hungry, we're a campaign of Share Our Strength. And we understand that the nutrition programs are out there. And what we do is try to work with partners and schools to increase access and make sure that the programs reach more children. We're aware that there are about 1 in 5 children that are facing food insecurity across the nation, which is about 13 million children. And we do know that that is, there are health disparities and disparities across communities, and there's higher numbers in our Black and Latino communities. That they suffer from persistent disparities in this area. And so we definitely know that there is an opportunity to decrease that, make it more equitable so that all students can have access to school meals. Next slide. So I'm going to just talk a little bit about our focus area, which is breakfast and breakfast after the bell, and some of the common barriers to breakfast participation. And really, these are very common and reasons why we do like to implement breakfast after the bell. Some students don't arrive right on time, and they might miss traditional cafeteria setting breakfast. There's also stigma attached to who's eating breakfast and who's going to the cafeteria. That could be an issue. Also in middle school and high school, a lot of students, when they get to school, they're really just not ready right then in the morning to eat breakfast. And so we'll talk a little bit about options for them, such as second chance breakfast. It could be just logistics. The cafeteria could be all the way on the other side of the school, and students maybe don't want to walk all the way over there, or their student in their peer group is located on the playground or located somewhere else, and it just seems like too much to go leave their peer group to go to have breakfast. And students would rather socialize with their friends and stick with their group than to break away from that. Next slide. So one of the solutions that we work with schools on and districts and partners is on how do you make breakfast part of the school day so that all the students who have access to lunch also have access to breakfast. And some of those ways are really just changing up a few things about how breakfast is served. And one of those is breakfast in the classroom. Where students receive their meals to the classroom and they're able to eat as class starts and just continue their normal day while having access to that meal. Grab and go, where students pick up their meal on the way to class. And second chance breakfast, as I mentioned before, where maybe after first or second period or between first and second period, the cafeteria is opened again, or there's carts available so that students can take a break, they can go get a meal, either come back to class or have time to eat their meal. Next slide. So you may be wondering, what does that look like? Wanted to show you just a few slides about what breakfast in the classroom looks like and how that happens. And so you'll see here, the breakfasts are in containers, and they're either wheeled to classroom. They are wheeled in different types of containers, and students sometimes are involved, and that can be helpful in terms of just really feeling part of the process. Next slide. And then grab and go, there's usually some sort of breakfast carts. They can be any type of cart. They can be just something that you pull together, or it can be a fancy cart. Maybe there's funding. There is funding available, and oftentimes, to be able to purchase these carts. And here's some different pictures of what that can look like. Next slide. And then what does second chance breakfast look like? It looks like grab and go, or it could be a traditional cafeteria where the line is reopened so that students can just go through and get their meal as well. Next slide. And so why are we even interested in alternative models or you know, creating more or different types of you know, breakfast methods? And that is because we have seen that breakfast in the classroom can increase participation to 69%, grab and go to 44%, and second chance to 43%. And so we have, you know, consistently seen that this can really help to increase access for students. Next slide. So, as I mentioned before, there are, you know, persistent disparities. This is one way to increase equity in a school culture and a school situation, so that students don't have to face that stigma. All the students are eating at the same time. It's normalized, and there isn't that as much stigma. It meets the needs of the school building and the culture by adapting to each school, so you can use the method that works with your school campus and your school culture. And we're going to be hearing from a nutrition director who has done just that on this call, on this session today. And again, it just brings breakfast back into the school day, just like lunch, so that it's just part of the process of being at school. Next slide. And then some things that you're going to hear about today in more detail from one of our presenters is how this can affect chronic absenteeism. And so what we've seen is that students sometimes don't go to school because of fear of, you know, they don't have lunch money or they're not going to be able to eat. And so this really helps to just increase access, and also that connection, which you're going to hear about from some of our speakers today, how you can build connection with students so that they feel more connected to the school culture and want to come to school. And I'm going to pass it to Hedy Chang from Attendance Works, who's going to talk to you a little bit about chronic absenteeism. Take it away, Hetty.
Thank you, Janine. So appreciate being here in the partnership with No Kid Hungry. I also want to mention that I'm joined here by Catherine Cooney, our Director of Communications. She'll be in the chat and you can reach her there. She'll share her email, but also she'll be posting resources that are relevant all along the way. It's such a pleasure to be here. Attendance works nationally across the country, trying to create awareness about the urgent challenge we have around chronic absence, but also talk about and highlight that this is a problem that we can address. We can get kids to school, and certainly breakfast in the classroom, breakfast at school meals are a key part of that strategy. But I'm going to step us a little back now to give you all a bit of an overview of chronic absence. So if you go to the next slide, I'm going to talk a little bit more about our chronic absence challenge. Let's go to the next slide. I want to also make sure that folks are all on the same playing field when we talk about or same page when we talk about chronic absence. Chronic absence is missing so much school that a child is academically at risk, but we've now created much more of a common definition, which is missing 10% or more of school over the entire school year. But that, if you use it throughout the year, it's an early warning system. So are they missing 2 days in the first month, 4 days in the second month, 6 days in the third month? So you can notice and take action. And if larger groups of kids, you can actually notice patterns. And this is including absences for any reason, excused, unexcused, or suspensions. And this is different from truancy, which typically only refers to unexcused absences and average daily attendance, which looks at how many kids show up to school every day, not which kids and how many are missing so much school that they're academically at risk. If you go to the next slide. And this is so important because if you click a couple times, chronic absence starting in pre-K and first is actually a predictor. If you click again of the inability to read on grade level, click again to lower achievement and even suspensions of behavioral challenges in middle school and not graduating from high school. So it's a really critical issue for us to address. And it's not, and if you click again, next slide, you can also see that it's very much associated now with the declines that we're seeing in NAEP scores. But we talk about chronic absence is actually a challenge for multiple reasons. It's not only it's a challenge for learning, but if you're not showing up to school every day, you don't have that routine that helps you to deal with chaotic transitions. You don't have engagement with your peers and with your adults. You're not accessing resources like breakfast in the classroom. And then you're also having the consequences for learning. If you go to the next slide, one of the things that we're seeing is an enormous increase in chronic absence, which is almost doubled. Almost from 16 to nearly 30% of all kids. That's 8 to 14.7 million children. And the data from 22-23 last year shows that it was still very high, even though we might have seen a little bit of declines last year. And it's especially high in the early grades, and then also starts to get much higher again in high school. If you go to the next slide, the thing is that this is actually a challenge found everywhere. There are chronically absent kids in cities and suburbs, in towns and rural areas. So it's something that we all should be thinking about. If you go to the next slide too, it's also affects all of our kids. White kids are actually in numbers the most, but large numbers of Latino, African American, and then there are certain groups like Native American, Pacific Islander who are still heavily affected. If you go to the next slide. But the thing that's so, I think, challenging right now is that sometimes when we think about 30% chronic absence, we think it's a third of kids who are affected by this, but it's actually much more. Because we are seeing such an increase in the number of schools that have higher extreme levels of chronic absence. High meaning at least 20% or more of their kids, extreme meaning 30% or more of their kids are chronically absent. And as you can see, that's now like 2/3 of all our schools now have higher extreme levels of chronic absence. And when you think about that from a kid perspective, it means now 2/3 of all our kids are in a school where the chronic absence level is so high that it's affecting the teaching and learning and the school climate for everyone in that school. So it's not just the 1/3 of the kids, it's the 2/3 of kids. And that is so much higher than pre-pandemic, when this was true for only maybe about 1 out of 4 kids, 25% of kids. If you go to the next slide. So, you think about this in terms of ripple effects. When a kid misses class, it affects everyone in the class, the kids who are doing projects, the kids working in groups, the teachers, the school as a whole. So ripple effects. And so it's not just the 1/3, it's the 2/3 of all kids who are now experiencing this. Next slide. Now, the other thing is, there are now more schools than ever who never had to deal with such high levels of chronic absence. This is particularly true starting even in the elementary grades, where before the pandemic, there was maybe 3,550 schools in the elementary grades that had high levels of chronic, that had extreme, this is 30% or more, levels of chronic absence. And now there are nearly 20,000. So that's 16,000 elementary schools who never had to deal with this issue, and now are having to deal with extreme levels of chronic absence. There are large numbers in middle and high school, absolutely true, but the hugest increase in terms of numbers has actually been happening in the elementary grades. Next slide. And what you're seeing is that it's increased dramatically in places struggling with poverty. So where you have 75% more kids, with free and reduced price lunch, you're seeing the increase in the percentage of schools that now have extreme levels of chronic absence, having gone from 25% to 69%. Almost all, almost 90% of the schools, 87% have higher extreme if you're in a high poverty situation. So again, now means that in our highest poverty areas, you have all of these kids being in an environment where chronic absence is affecting the learning and the school climate for everyone. Next slide. And again, this is particularly true for high poverty districts, where in many of those high poverty districts, more than half of all their schools have 20% or more levels of chronic absence. And if you compare that with schools, the places that don't have high poverty, where if you look at that, the green on the right side, what you're seeing is in 2/3 of all the schools with less than a quarter of their kids with free and reduced price lunch, in 2/3 of the schools, those districts, they don't have any school with extreme levels of chronic absence. So it is our highest poverty areas that are being most affected. Next slide. And what I, again, want you to really think about this is thinking about chronic absence, which is different from average daily attendance, which is how many kids typically show up each day, or truancy, which is unexcused absences. This is looking at all absences, emphasizing missed days, looking at prevention, problem-solving approaches, because when we know kids have faced trauma, when we know they've faced challenge, the worst thing you can do is say, what's wrong with you? What we most need to do is say, what happened and how can I help you? And if you go to the next slide, one of the things is that often you can even see when we have unexcused absences, let's say kids have each both 5 days of and they were ill. One has access to health care, comes in with a note, the other does not. The kid who doesn't come in with a note, they're considered unexcused, and that may both lead to them not being helped in the classroom, denying class credit, even teachers thinking, oh, well, Janine doesn't care because she didn't show up. We're trying to move people away from a kind of punitive approach to a problem-solving approach. If you go to the next slide, this is really about saying, what if we want to improve attendance, we got to understand why kids are chronically absent in the first place. Is it chronic and acute illness, trauma, housing, and food insecurity as one of those issues? Is it that they have anxiety and they're not connecting to their peers? Is it because they don't have meaningful relationships to the staff or engaging opportunities? Is it because they actually don't understand that missing a couple days can be a challenge, or they actually don't understand, especially in the aftermath of a pandemic, when to show up to school or not if they show a sign of illness? Now, if you go to the next slide, we know these high levels of chronic absence are very much connected to when we see an erosion in physical, emotional health and safety, or that sense of belonging, connection, support, or academic challenge and engagement, or adult and student well-being. So in order to change this, we have to put back in place these positive conditions for learning. If you go to the next slide, make sure that, if you go to the next slide, that they are the foundation for a tiered support system, where then you add in more supports based on data if kids, if the positive conditions for learning weren't sufficient. But it's beginning with that prevention and that investment in positive conditions for learning that's so key. If you go to the next slide, in the face of our pandemic, what this really means is we have got to engage families more deeply than ever before. We have to ensure student connectedness. We have to support health and safety and community partnerships in schools. And I think this is an incredible framework for thinking about nutrition programs for breakfast in the classroom, because you can both do those in ways that essentially, if you give kids nutrition, they're going to be more healthy, right? If you promote connections in the ways that Janine talked about, in the ways that you can implement breakfast in the classroom, you're ensuring student connection. If you talk to families and engage them in the program, you can even support engagement. And you can also use your data to make sure that the schools that need it most, or the kids that need it most, are getting these kinds of supports. So with that, I am going to turn things over to Karen.
Thank you so much, Hetty, for that excellent background on chronic absenteeism. My name is Karen Wong, and I'm on the research team on the No Kid Hungry Center for Best Practices. And I'm really excited today to be sharing a bit more about a study that was conducted back in 2019, looking at breakfast after the bell and chronic absenteeism. Next slide. So you might be wondering if there has been research that's been done looking at the connection between eating breakfast and chronic absenteeism. The research that had been done to date when we had commissioned the study had looked primarily at breakfast after the bell and attendance rates. But as Hetty mentioned, chronic absenteeism is a specific measure, and there had not been studies that had looked at that at the point that we did the study. So we put out a request for research proposals to answer the question, can serving breakfast after the bell reduce chronic absenteeism? And through the competitive process, we identified two leading education researchers and economists, Doctors Michael Gottfried and Jacob Kirksey, to design and execute the study. They were at the time at the University of California, Santa Barbara, but they're now at UPenn and Texas Tech, respectively. So another unique component of the study, aside from looking specifically at chronic absenteeism, is that we looked at both state and national data, whereas previous studies had only been able to look at specific cities. Next slide, please. So I'll really briefly talk about the methodology for the research. So in the state analysis, we looked at two states, Colorado and Nevada. So these two states had passed legislation requiring high poverty schools, where 70% or more of the students are eligible for free or reduced price meals to provide breakfast after the bell. So the schools that were subject to the law and had to provide breakfast after the bell could choose any model that included breakfast in the classroom or grab and go, etc. So for the analysis, the researchers actually looked at 2 years of chronic absenteeism data, so following the same schools over 2 years, and they compared schools that were newly adopting breakfast after the bell due to the law to schools that did not. As a result of being able to control for different factors and look at the before and after, this was a really strong research design that isolated the impact of breakfast after the bell and allows us to essentially infer causal effects from breakfast after the bell. So in the next slide, I'll just really briefly talk about the national analysis methods. So in the national component of the study, we relied on an existing nationally representative survey. That survey had information starting in kindergarten, following kids into the first grade. And in the survey, we had information on whether or not the kids were attending schools with breakfast in the classroom. So in this analysis, we also had those 2 years of data following the same students, and we compared those students who newly had breakfast in the classroom to other students in the same county that did not. Another exciting aspect of this national data is that not only did we have information on chronic absenteeism, but we also had some information on other student outcomes like achievement scores and social emotional development. So in the next slide, so what did we find? We were extremely excited to see that we found robust findings across multiple contexts, both in the state and national analyses. So in the state research, we found that chronic absenteeism rates were on average 6 percentage points lower for schools that were operating breakfast after the bell. We found that the higher the breakfast participation in those breakfast after the bell schools, the greater the reductions in chronic absenteeism. So there's definitely an important component where increasing breakfast participation is making a big difference in chronic absenteeism. We also found that high school were more likely to see even greater impacts on chronic absenteeism, which is important considering what Hetty had mentioned about high schoolers having high rates of chronic absence. In the national research, we also found again that chronic absenteeism rates were lower for young elementary school students that had breakfast in the classroom. Again, very important since Hetty had mentioned elementary school earlier on, students are more likely to be chronically absent. And because we had that data on other measures like achievement and social emotional development, we were able to find and look at those aspects. And we found that breakfast in the classroom can improve reading test scores. And it also improved something called internalizing behaviors, which was measured by anxiety, loneliness, low self-esteem, and sadness. And while we didn't have any qualitative data collection as part of this study, so we can't really exactly pinpoint maybe what were the factors that were contributing to this, we do hear anecdotally from school staff that breakfast after the bell is improving overall school atmosphere. It's reducing that stigma. It's getting kids ready to learn. So those could be potential factors that are contributing to why we're seeing these positive effects. I am excited to be able to hand it over to the next presenter, Felipe, who will share a little bit more about student engagement and how his school district has effectively built relationships to connect students in school nutrition programs.
All right, thank you. You guys hear me all right? All right, cool. So yes, I'm Felipe. I'm the Director of Nutrition Services at Fort Wayne Community Schools in Fort Wayne, Indiana. We are the biggest school district in Indiana. And, we're big in Indiana, but we're small fish around the country. But that doesn't matter, right? Because I think we're still getting some things very right. And I'm excited to share some of the things that we're been working on the past year or so. So next slide, please. So it's interesting when we talk about nutrition services, and hopefully every school district has a nutrition services department. And we are here considered a support department. And to me, that means that we're not only providing a service, we're not only feeding students, but we're providing a service that's so much higher than that. We're helping in the educational journey of our students. And we're trying to make sure that we not only prioritize just the meals and what we do, but their well-being, and that includes physical, emotional, and social health. And we're trying to be an active player when it comes to those things. It's very hard, very challenging, but again, as a support department for our district, we're not just feeding kids. We're providing a holistic approach in what we do and with our interactions with students. So next slide. All right, so something that we have to think about with nutrition programs is, first of all, who is our customer? And if you think about it, a school system, and not just nutrition services, but for the whole school system, the customer is the student. So we try to provide services that match, those expectations. And food is one of those, teaching is one of those, and some of the other functions. So students are architects of change. They're supposed to be involved in the process of decision making And they should be involved in that process from day one until implementation and monitoring, because this is a service that we provide to them. It would be crazy to think about a business that doesn't think about customers, because they will go broke. This is the same for us. We're providing meals and we're feeding students, but we have to make sure that we are involving them in this process because we're serving them. And they're going to be your best advocates at promoting the program. Now, this new generation that we have, they're very good at social media, very good at technology, they're very good at expressing their opinion, and they're going to be the ones who can make or break your program. And if you have a very good program that recognizes those things, especially the student involvement process, they're going to be your best advocates, and they're going to have a sense of ownership and pride because they're part of that process. And that makes it so much more powerful when you have students backing up your program, not just from a financial standpoint, but from a holistic approach that, they're participating from the meals and they're very nutritious, and they feel it's the best thing they can do, in their day. Next slide. All right, so to talk about changes, I feel that I have to talk about some of the things that we've done in here. And this is the org chart for our, our old structure. And I'm not going to explain why I have it here. It may look weird to you, but change can't happen if you keep doing the same over and over. To elicit change, you got to experiment. And experimenting, you're going to have failures and successes. And so something that we've done in the past year, I restructured our department. And I just wanted for you to have a look at how it used to look like and then how it looks now. But when we think about creating connection with students and enhancing programs, and making sure that we are serving what we're supposed to be serving, based on the feedback from students, parents, and the community, I thought about, hey, we just don't have the structure to support that, and we have to do something about it. So if you go to the next slide, you're gonna see that the structure just blew away. And I added a bunch of new positions to increase outreach to not only our cafeterias, but for student engagement. Because again, we have to listen to them. And there's a reason why they like what they like and why they dislike what they dislike. You have to know specifically what they like, what they dislike. So this whole move into new positions, new structure, new support for our department is to sustain those changes. Change is good as long as you have a plan for sustainability, and it's not just climate. You have to have a sustainable plan that's going to carry over throughout time, but it's flexible enough to change based on the feedback and some other contextual factors. So this is our org structure right now. We have, dietitians and coordinators and operations managers. We have, and plans working with a chef, and we've, blown this org chart out of proportions, but is to provide that support. And I'll explain later how we were able to fund this as well. So next slide. All right, so we here at Fort Wayne Community Schools, we operate the Community Eligibility Provision, or CEP. And so this program is based on it has different, guidelines. And it's based on the poverty levels in your district. So it's off by your direct certification and includes SNAP and TANF. And the threshold for a school to participate in this program is about 40% or greater, determined on the last year numbers for direct certification. Here at Fort Wayne Community Schools, we're lucky that now we have 100% CEP. That is massive when it comes to your program, because that can maximize, all the financials, the reporting, but at the same time, you can offer breakfast and lunch at no charge, free to all students. So you remove some of those stigmas that come with eligibility guidelines. So the next slide. So once I took over as the director, that was about 10 months ago. I made a study about, how we can maximize CEP because we weren't 100%. And the study that I conducted revealed pretty cool insights and data. So we had 3 groups, and one was reimbursed at 95.50%. So that means that 95% of the meals that we served in that group were reimbursed at the free rate, and then 4.5% at the paid rate. Then group number 2 was 92.34, and the third one, very low at only 68%. So again, I conducted a study and I realized that, it's very feasible that we can get 100% if we redistribute some of the groups and numbers. So next slide. All right, and I'm not going to bore you with the math and the approach that I have. Willing to talk about it, maybe in a different setting. But I use data analytics and statistical analysis to get this. So I use 2 different machine learning algorithms. One is k-means clustering and one is called dbScan. So k-means clustering is just groups, a certain criteria based on what you're specifying. And then dbScan kind of does the same, but with outliers. So it's really good at capturing some of the outliers that you may have in your data. So this data-driven approach was hard to come up with and to implement, but the idea was to form groups based on their ISP, which is identifying student percent, and that comes from your direct certification numbers. So my idea was to try to form groups of 62.5% or more, and as many as I could. So the algorithm can run different probabilities to create those groups. So next slide. All right, so to make this successful, you have to have data. You have to collect data, and probably your state agency can help you with the direct certification data. And once you have that, you have to make sure that you have the right type of information. Then I ran, those machine learning algorithms. I took the data and then I manipulated that a little bit myself with a threshold setting of 62.5%, because then that gets multiplied by the USDA factor, which is 1.6 to get the actual reimbursement rate. And then I did that for a couple of weeks. It wasn't an easy process until we finally got there. Now, what's the result? You're wondering, what is this significant to be 100% CEP? So if you click, so in our operation, we have as of, when I took over, it was about a $21 million operation. So this created an additional $2 million in net revenue for us. So that's an extra $2 million reimbursement. And this is locked for 4 years. So this is really significant. So $2 million for us, it's a little, roughly 10% of, our operation. And that's for 4 years. So if you think about it, there's a lot of things that we can take this money and use it for to make this program a lot better. And that's exactly what we're doing. We partially funded that reorganizational structure based on our CEP new reimbursement. And now we're using the rest of the money to come up with new ways to support our program. So next slide. All right, so we, at Fort Wayne Community Schools, we have different models that we use, but the one that is right there, it's a hybrid model between breakfast in the classroom and breakfast after the bell, which you may be wondering, well, maybe we've never heard about that. Well, you can for sure do something like this. So our idea, once upon a time, we had breakfast in the classroom, but it is very labor intensive. You have to come up with a system that works. And even after that, it is very labor intensive with your staff. It's great for the kids, but it takes a little bit of work to do it. Now, then we moved away from that and we created kind of this hybrid model. So what we do is at every single entry point in our schools, we have staff with their cards. and what we're offering for breakfast. So our thought process was, we want kids to have access to breakfast. So what are some of the, barriers for that? Is it the location, going to the cafeteria? Is it that, they have to walk, or, is it that they're getting late to school? So we, some of these things played a factor in that. So we determined, well, if we have cards right there in the entry points, like all the entry points for the school, we're gonna get it right to them. So there's no walking around, there's no wondering, like, am I gonna get breakfast today or not? So we did that. And then they grab the breakfast, and then they take it to their classroom. And then the hybrid model with the breakfast after the bell is that we offer breakfast until 10 in the morning. So we offer for a very extended period of time whenever we try to catch all the late kids. So once, the ring bells, we pull some of that operation back to the cafeteria, but the kids, they know they can still come to us for a second chance breakfast, and it's always available. And sometimes, it may be very late, that it's almost overlapping with lunchtime, but they still come to us because they know they can get breakfast, and it's always there available. So we've implemented this model, and it works, because we're trying to minimize some of the barriers they have with this kind of a hybrid model. And this year, so going off, the feedback, and students are architects of, change and in decision making, we added a coffee bar. So for our school district, high school students' starting time changed this year to be a little earlier than it was before. And we thought, hey, what better way to support them than implement a coffee bar? It's a fully reimbursable breakfast. And we're providing something nutritious for them, and helping with, maybe them being tired, or just, making the switch to an earlier, schedule. And this is being really successful. So if you go to the next slide, that next one, you can see the impact this had. So on the month of August, we had a 28.6% increase in participation just by adding, this new offering. Then it went down in September, but it's climbing up again. And as everything new you have, you make an impact, you make a statement, then it goes down, and now it's trickling back up. And it is very interesting because we're seeing a different trend with lunch. Lunch is a little lower, but it's following the same trend we had last year. But breakfast, it's following a totally different trend this year, because we implemented something eye-catching, something meaningful to students, and something that works for them. And again, it doesn't have the same impact in all the different high schools, because we have different demographics. But in the ones that really work, it is really statistically significant. And then in the ones that, it doesn't have such an impact, it is still making a statement about our program, because it changes perception. It changes perception about the quality of what we do and what we're offering. And we have a lot of kids that have expressed that. So next slide. So this, the projection so far is that it's going to bring about $100,000 extra in reimbursement this year, just by that increase in participation. All right, so some of the future initiatives, student ambassadors. So to me, this is really cool, because again, like I was talking about, who is better equipped to promote your program than students? They're the ones consuming the product. They're the ones getting that service. So if you're going to have someone who is supposed to promote the program, it should be them. They're going to be your best ambassadors. But that comes at a price. That comes at a high price. And what's that? You would ask. Well, you got to build relationships with them. You have to build relationships, not just with them, but with the school administration. And that takes time. And again, the restructure that we had in our department is one of the big reasons is to create those connections, is to have enough time to sit and not just go to business, but just say, hey, this is me. I want to contribute something meaningful to your school, or to your classrooms or, whatever it may be, and just you start creating relationships and you start gaining buy-in from the school administration, from teachers, and from other, key stakeholders. And that it is extremely meaningful because then everyone is on the same page. And whenever you want to implement some of these new changes, of course, it's always going to be challenging, but at least you have an advantage because it's not just something you want to do. It's not just something you want to throw out there. It's something that you can very well talk about and say, hey, I have this idea. What do you think about that? And, this is going to influence, some of the decisions we're going to make. So what do you think about this? Or how you want to be involved in this process? Even if it is a little bit of hard work, it's for the students. And that has a total different feel. But you have to create those relationships first to have that type of conversation about implementing change or having different initiatives. And that trickles down to the students as well. If you have everyone excited about the program and everyone talking positively about it, students are going to get in that same mindset and they're going to have, they're going to start buying into your program and they're going to experience something different. So if you click again, we're stepping up our marketing efforts, and it's really cool because in our district we have it's something new. It's kind of a marketing pocket that students have, and we want to start recruiting them for marketing efforts. We're starting a paid internship for students in our department, not just for summer, but for a year round. And again, who better to promote your program than students? They know social media better than anyone. And they're the ones, again, if they have that buy-in, they're going to be your best advocates. And when I was trying to decide whether to create a position for marketing, specifically for marketing, I had the chance to meet this group of students, and my mind just changed right away. And I say, you know what? I want them. They're going to be highly influential in what we do, and I'd rather pay them than anyone else because, again, we're part of the educational process. This is going to give them meaningful experiences, paid experiences, and then they can use their talents, which they're really good with this. So next one, the next one. So culinary arts, we're having the same approach with the culinary arts students. We're going to start engaging with them. And the idea is for the students, again, to have buy-in from us and from our operation, and then take what we do and give it a spin. So the final idea with this is to have, menu items that are certified by the culinary arts program and some other items that have been created by them. And we want to market this very heavily because we want to make sure that everyone knows we're involving students in this process. So next one. And then you got to understand, your school culture. Every school is different, and you have to acknowledge that. So a cookie cutter type of approach won't do it, and that's exactly what we're working on right now. So the coffee bar approach, we did it for all the high schools, and now we're going to start tailoring some of those things to different locations because you got to be mindful of those things. But it's not just our operation; it's the school culture. So when we reorganize our department, we're bringing in personalities that know how to create relationships, and there are certain personalities that fit better in certain parts of the district. So we're being extremely mindful and intentional about those things and how personalities work better together than some other ones. So we want to make this work, and we're trying to do that based on school culture and preferences and demographics. All right, next one. And again, this goes without saying, but you got to involve parents and the community. For elementary students, I believe parents are highly influential in what they get for lunch. And that involvement then trickles down to middle school and high school. So to make this successful, you have to involve parents in a lot of different capacities so you can have their buy-in early on in the process, and then that has that trickle down effect. And next one. And just try to be inclusive, be excited. If you're wanting to create effective change, that has to start with you. and change can't happen if you don't believe it. So in this process that we've had, one thing I've asked of my staff, it's what is your higher purpose? And we have to define our higher purpose. And you know what the higher purpose is? It's students. That's all we do. You know, our positions were created for students to support them. And we've had this higher purpose right here in front of us during this whole journey. And that really makes a difference. And that allows you to, you know, when you have differences of opinion or you have different things you may want to do, is who is you know, the one who's going to get this at the very end. And you know, we were able to come up to agreements and to make decisions based on that. But you have to be positive. You have to create something, you know, that you're proud of. And to do that, again, you have to have a higher purpose, and you got to believe in it, you know. But that starts with you. So I think that's all I have.
Lots of great information. Thank you, Hannah, for stopping at the question ones. I was going to tell you to move forward. You shared so much and intertwined with a lot of the things that Hedy mentioned in terms of connection and really building those bonds and creating safe spaces. I feel like you're doing so much of that in your program, Felipe, in such a thoughtful way. Thank you so much, everyone, all the presenters, for just, you've given us so much to think about, so much great information. I'm going to start, because we only have about 10 minutes, with some of the questions that were sent to us. The first one, I answered it, Felipe, but I want to make sure I answered it right. They asked, do you sell coffee from the coffee bar, or is it included as part of the reimbursable meal? I know you mentioned it's part of the reimbursable meal, but do you want to add any detail to that answer?
Yeah, so the way we tackle this one this year, so we have our breakfast, and then the coffee is just an add-on. So it's part of the reimbursable breakfast, but we're not making it just that. It was a little more complex to do it that way, but not that we can't do it in the future. But that way we make sure that the students take not just the coffee, but everything else that we offer. So we believe that's a more well-rounded offering. Because otherwise I think they will go just straight to the coffee. But again, I don't think there's a right or wrong. You know, I mean, I think that the approach could be tailored, and you know, maybe we can approach that in the future to see how it goes. But I think a more well-rounded, you know, breakfast, it's not just the coffee, but you know, everything.
Awesome. Thank you for that. We have a question for Hedy as well. The question is from Charlene Tello. It says, what if the students' absenteeism, but the staff, it's what's causing the students to be absent?
Yeah, thanks, Janine. I think I understand the question, which is, what if it's the staff that are actually causing the kids to be absent and miss school? And you know, we talked about these different buckets: barriers, aversion, disengagement, and misconceptions. And there are staffing issues in both the aversions and the disengagement. You know, the staff could be if they're using problematic disciplinary practices, or if, let's say, you have in some places they're hiring, you know, this is controversial, so I'll say there are mixed feelings about that, but where you have kind of a heavy police presence because they're trying to do school safety, but for kids who've had negative experience with the cops, then they don't want to show up to school. So one thing I would just say is I can't tell from the comment when she says it's staff that's causing kids to be absent, like what's behind that. And I would also say, this is just expanding, you know, Felipe was really talking about youth voice and the importance of youth voice, whether that's marketing or implementation. The same thing holds true for anything around attendance. You need to actually talk to kids, find out their perceptions, and also find out from staff. And then when we can understand, like maybe the problem is it's ineffective school discipline practices, and the problem is that staff don't actually know effective school discipline practices that don't threaten kids. And then that's a staff training issue. But understanding why kids might not show up and what might be causing it, and then what are the solutions, requires talking both to kids and staff as well as families to really figure out how to move forward. But we should make assumptions about what it is.
Thank you so much for that explanation. There's just so much there. Like I said, we could talk on, and there were so many questions submitted before the webinar that I know y'all can feel free to reach out to our participants, our panelists, that is, to answer some of your questions. But before our time runs out, because there's just been so much wonderful information shared, I wanted to give each of you a chance to really address what are your key takeaways? What is the message that you really want to send home to all the participants here? We had a lot of questions about implementation and participation and on and on and on. And I think my key takeaway from y'all is it really, really has to do with building those relationships and connections and connecting to the main audience and your main client, which is the students, which is the school community. But I'm going to pass it to Karen, then Felipe, then Hedy, to give really what is your most important advice, information that you would like people to walk away with today before the webinar time is up.
Thanks, Janine. Yeah, I was just really inspired by my fellow panelists, and I think one key takeaway that I will bring with me is just the importance of centering the students, really, and just reminding ourselves of why we're doing the work that we're doing. So I appreciated that reminder.
Felipe, I'm going to pass it to you. Thank you, Karen.
Yeah, I'll go. Since we have a chance in here to work with students, I'm going to say that having that higher purpose in mind with everything that we do, and truly believe it, really finding our why to why we do what we do. It's really rewarding and meaningful, and I encourage everyone, whether you work in school nutrition or you're part of the school building, with whatever function may be or the district, is really think about that, why you do what you do, and then truly believe it and live it. And that's going to make a meaningful impact in those relationships that you build and how you see work, and how you contribute to that whole experience for students.
Thank you so much, Felipe. And I feel like students know when you care. They really know, they feel it, they sense it, and that really helps them to feel, accepted and comfortable at school. And I'm going to pass it to Hedy.
Sure, thank you. And I'm going to try and use this as an also way of coming back to the questions in the Q&A, which is, why is chronic absence so much higher since the pandemic? And as I mentioned before, I think it really is those positive conditions of learning that have been eroded. Kids and families not feeling that school's a physically, emotionally healthy, safe place, as well as that's very connected to that lack of a sense of belonging and engagement. And I think this is why what I would hope people take away is that relationship building, as you mentioned, Janine, is absolutely essential. And we may both need to make sure how we organize schools, build relationships. That's why breakfast in the school classroom is so important. But how we invest in our staff and the well-being of our staff so they can show up every day. And some of this also is really investing in the health supports for kids and families, both prevention so that people get sick less. And actually, by the way, having access to nutrition is part of that prevention, but also making sure that we are really helping people build those connections to each other, because that keeps to the well-being, but also make sure that they aren't missing school unnecessarily, either because they don't engage in the prevention or because they think for very minor illnesses for which you actually can be in school, that they're missing school. So really thinking about how we invest in relationship building and make sure that kids and families see schools as healthy places where their connections to each other, their access to food and nutrition is part of staying healthy.
Awesome. Great wrap up, y'all. Thank you so much to all the presenters, to everyone who came. And as I mentioned, don't forget to fill out the survey that you're going to receive a few minutes after the webinar. And in the next few days, you will receive the recording, the slides that have all the links, And just thank you again to all the presenters. You did amazing. Thank you so much. And
Thank you so
please
much.
reach out. Mhm. Our pleasure.